Baryta and calcarea. Very simple differentiating feature. In Cilicia, the shyness is so severe, even the stools are shy. Stool will go out and come back. Goes back to the rectum. That is typical of silica. Silica is very chilly, very chilly. Even in summer, like Sorinum, wants to cover even in summer. Even in the worst of the summer, you'll come them, you see them with full clothes or sometimes covering with, and at night they would cover even the head. That is silica. Covering out of fear is Kali by Jalsemium, but covering because the head should not pain. That is silica. You cannot miss silica. An unhealthy skin, slightest of the injury suppurates. Same with Sorinum, same with sulfur. See how you can study the remedy relationship and compare them. Now, how do we differentiate Baryta and calcarea? This is very important, and this is not written in any book. Calcarea has got all the milestones delayed. This is not written in book. If you practice, your 90% of the children will get better when you give the right remedy. Calcarea have all the milestones delayed. That is walking, talking, teething. Everything is delayed. While Baryta is a genetic remedy. It goes deep down to the genetic level. So in Baryta, one of the milestone is delayed. One of the milestone. What happens? Either walking is delayed. See, walking should happen at 1 year, right? Teething should happen at 6 months. Talking around 1 year. Now, teething happens at 6 months. Walking happens at 1 year. But talking is delayed by 2 years. The child doesn't speak even few words. That is Baryta. And then, irrespective of condition, irrespective of what is the diagnosis, irrespective of anything, you give Baryta and the patient will feel better. The salt you have to differentiate whether the child will require Baryta mure, which will have constipation more. Wherever mure elements goes, like natrum mure, mag mure, the constipation will go together. Wherever there is Baryta carb, air hunger with chilliness will go. With Baryta sulf, there will be more of skin infection. With Baryta silicata, the whole of shyness will be visible. See, that is why, and people nowadays prescribe only on mind or only on body. No. Both mind and body have to match so that you prescribe and get the result. Never get yourself bogged down by one particular system of prescribing. Always try the variety. And your mind and body has to match. The thermal response of the body has to match. So Baryta will have patchy. The child is walking, talking. He is 1 year, 6 months. No teeth, not even one tooth. That is Baryta. Now we go to the very interesting aspect. This is trio of allergy. The ferrum, hepar sulf and pothos. You name the allergy. Allergy from dust, allergy from pollen, allergy from eating, allergy from food. You name the allergy, but predominantly dust allergy, pothos, hepar sulf and ferrum. Very interesting tip, and lot of your problem will be solved when you understand these 3 remedies. Pothos, I have explained you. The pothos patient is better by passing stool. So allergy to dust, better by passing stool, and you can forget about rest of the things very easily. Hepar sulf is another interesting remedy, but a very chilly remedy, just like silica. feels better with warmth. Okay, and the ferrum is the king of allergy. See, ferrum contains iron, and iron is there in our blood, which moves in the whole body. So in ferrum you can treat hundreds and hundreds of cases of allergy, okay, without even any hesitation. Like allergy to prawns, allergy to fish, allergy to eggs, allergy to dal, allergy to any substance on this earth. You can think of a remedy, ferrum. Just close your eyes and prescribe ferrum. The allergy will disappear. But you have to be very careful. It has to be ferrum mat or ferrum phos or ferrum sulf or ferrum mure. You have to differentiate and come to a right salt of ferrum. Understand? So you can get, very, like you can have asthma, or you could have urticaria, you could have wheezing, you could have anything, itching, anything. You get a lot of cases with nickel allergy. They wear a bangle or a jewelry and they develop allergy. That is nothing but ferrum. So ferrum is king of allergy, and you can help many patients with allergy, and just like amazing speed. Stenum covers a particular kind of allergy, but the ferrum has got the widest of the widest range, and this we have proved it clinically in many patients. Another interesting thing, the ferrum pain is better. Asthma is better. Pain, asthma, any symptom is better by slow motion. Slow motion, the patient feels better. Okay? While any complaint, may it be asthma, may it be rheumatism, if the patient feels better by rapid movement, it's not restlessness, it's the movement which is very important. What is the remedy? Sepia is better by rapid movement, while ferrum is better by slow movement. See, although asthma, the patient cannot move. With breathlessness, how can you move? But still, the patient is better by movement. It's ferrum, better by rapid movement. It is sepia. Now we go to next lot, the lot of thirstlessness with the asthma. Thirstlessness with asthma, there are 3 remedies: pulsatilla, bryonia and apis. All these 3 remedies are thirstless. What is the characteristic of pulsatilla? All of you know, it's a mild remedy, soft spoken, weeps easily, more aggravation in the evening, not much of problem. Bryonia is dryonia. Anything which is dry, mucous membrane dry, rectum dry, skin dry, everything is dry, with a tremendous thirstlessness, and other extreme, very thirsty. Thirstlessness and extremely thirsty. Okay? But what is important? Bryonia is the only remedy which gets aggravated at 8 p.m. Asthma at 8 p.m. it is bryonia, very characteristic. And apis is one of the remedy where you will find lot of congestion. You will hear